You know, pregnancy is supposed to be a time of excitement and anticipation, but it also demands some incredibly careful medical attention. Today, we're going to break down one of the most serious complications that can happen during pregnancy, preeclampsia. It's a condition that the medical world knows all about, yet it's still a major cause of harm for both moms and babies. So let's get into why that is.
Wow. I mean, this quote from our source material really just cuts right to the chase, doesn't it? The idea here is that when preeclampsia isn't managed well, it's not just a medical problem. The source argues it's often a failure of the very system that's supposed to protect mother and child. This really sets the stage for everything we're about to cover.
So what exactly is preeclampsia? Well, here's the thing you have to understand. This isn't just about high blood pressure. Not at all. It's a really complex disorder that shows up after 20 weeks of pregnancy. And it's a disease that attacks the entire vascular system, putting essential organs, we're talking the liver, kidneys, and even the brain, at serious risk.
Now, if preeclampsia isn't managed, and managed aggressively, it can escalate into something even more terrifying, eclampsia. Our source material calls this a catastrophic failure of medical management. The moment seizures begin, it's a whole new ballgame. The risk of permanent damage or even death for both mom and baby just skyrockets.
So you can really see how this is a domino effect, right? It often starts with gestational hypertension, that's high blood pressure during pregnancy. Then it can progress to preeclampsia, where the organs get involved, and if it's still not stopped, it can end in eclampsia, with those life-threatening seizures. Every single one of these steps is a massive warning sign, an opportunity to step in. So here's the billion-dollar question. If there are all these signs, why are they missed? Well, according to the source, a huge reason is that a patient's symptoms get written off. That severe headache or that sharp abdominal pain gets brushed aside as just, normal pregnancy stuff, when it could actually be a critical sign that something is terribly wrong. Let's be really clear about what these red flags are, because medical teams are absolutely trained to look for this stuff. We're talking about a blood pressure reading of 140/90 or higher. Protein in the urine, which shows the kidneys are under stress. A low platelet count, which is dangerous because it affects blood clotting. And then you've got the symptoms the mother feels, that intense pain in her upper right abdomen, a sudden thunderclap headache, or changes in her vision like seeing dark spots. These are not just discomforts, these are major diagnostic clues.
Okay, so we get the symptoms for the mom, but what is actually happening on a biological level? More importantly, how is this all affecting the baby? Well, the answer lies with the placenta, the baby's literal lifeline.
Everything, and I mean everything, hinges on the placenta. The mom's dangerously high blood pressure doesn't just stay in her system. It causes the tiny, crucial blood vessels inside the placenta to tighten up, to constrict.
And this clamping down is just devastating. It's like putting a clamp on a garden hose. It creates a bottleneck that chokes off the supply of everything a growing baby needs: blood, oxygen, and nutrients. The source basically says it starves the fetus of the very things it needs to develop and survive.
And this, right here, this is the absolute worst-case scenario. When the baby's brain is deprived of that oxygen-rich blood, even for a short amount of time, brain cells can begin to die. The result can be a permanent, irreversible brain injury. This oxygen starvation can lead to some of the most feared complications in all of medicine. Things like placental abruption, where the placenta literally tears away from the wall of the uterus, hypoxic ischemic encephalopathy, or HIE, which is the medical term for brain damage from a lack of oxygen, and intrauterine growth restriction, where the baby just can't grow because it's not getting enough nutrients.
This brings us to a really critical concept called the standard of care. According to our source, medical negligence isn't just a simple mistake or a bad day. It's defined as a failure to follow the established, evidence-based rules that were put in place specifically to prevent these exact terrible outcomes.
And this chart just lays it out so clearly. On one side, you have the standard of care, what should happen. You identify patients at high risk, you do frequent blood pressure and urine tests, you give magnesium sulfate to prevent seizures, and you deliver the baby in a timely manner. And on the other side, the source defines negligence as the failure to do those exact things: failure to screen, failure to monitor, failure to medicate, or delaying a necessary C-section.
So this leads to the one question that so many families who've gone through this have to ask. Is there a direct line connecting a mother's eclampsia to a child developing a lifelong condition like cerebral palsy?
The source could not be more clear on this. The answer is a definitive, heartbreaking yes. When the seizures and oxygen deprivation from eclampsia cause brain damage to the fetus, cerebral palsy can absolutely be the direct result.
And the impact doesn't stop there. The damage that happens in those critical moments can echo for a lifetime. We're talking about cognitive and developmental delays, seizure disorders like epilepsy, and the need for constant, specialized care for the rest of that child's life. It just goes to show that a preventable birth injury has consequences that last for decades.
So we end on this really heavy thought. Our source material makes a powerful case that many of these outcomes aren't just inevitable tragedies, they are preventable injuries. And that leaves us with one final crucial question to think about. In a system that's designed to protect us, who is responsible when it fails?